Bortezomib, I discussed earlier, is really useful in patients with Waldenström's because if we think about BTKis, they've had a really significant impact over the recent years with being tolerable therapies, with good efficacy, and actually it's a big challenge with patients who've failed BTKi therapy because options are limited. Often these patients have progression in the majority of cases, and in a smaller proportion it may well be because of toxicity from BTKi therapy. If we look at data that's presented in the real-world setting, there's very little out there about what to do after BTKi progression other than clinical trials that have reported. In the UK, we have some experience looking at Bortezomib in patients after BTKi failure. So we talked about 16 patients in a series of a group of those who progressed or had toxicities, and these patients had very reasonable outcomes. So had over a good period of median follow-up, they had a good treatment-free survival interval, and a proportion of those managed to have further lines of therapy and did not compromise future lines of therapy, which included in 2 cases further BTKi therapy.